First of all, I want to thank Senator Byrne. I want to thank the Senate for the work they did on this bill. It's obviously a very difficult issue and a kind of a sensitive issue, and so I think they gave it a lot of due course and attention on the Senate side. One of the things, and there's a benefit sometimes to going second, being able to watch all the testimony and see how everything happens. And so what we tried to do in Amendment 11, what I tried to do is sort of focus the bill a little bit and focus it more on actions, because I think it can be difficult to legislate words and acronyms. And so we really tried to hone in on the actions that we are trying to address. And just everybody knows, really, this is all kind of a continuing response to the Supreme Court's decision in Students for Fair Admission versus Harvard, where the court basically indicated that it's no longer appropriate to look at personal characteristics, race, and other things when making admissions decisions. There was some language in there suggesting it might also apply to employment under Title VII. And so we saw the president's executive order. Governor Braun had an executive order. And this really is an effort to sort of codify those and to be consistent and to make sure that we're not going to use those personal characteristics, which we cross-reference to the Civil Rights Act in Indiana for educational opportunity decisions, employment decisions, licensing decisions, and those main government actions. So that really is just an effort to take what Senator Byrne did and just kind of focus it a little bit more. Again, having the hindsight of the testimony that we saw, and and make it a little bit more workable for some of the folks that are going to have to abide by it. So with that, are there any questions or comments on my amendment? I'm happy to answer them. That was mine, so I want to be fair to that. Yeah, Representative Burton.
I just say thank you, Mr. Chairman, for at least, though I have my concerns, I appreciate your amendment that I think is better than what was originally proposed.
Representative Garcia-Wilburn.
Thank you, Mr. Chairman. I appreciate the work that you've done to clear the muddied waters. I do have a question regarding the cause of action, however. It seems that the fines are really out of line regarding the liquidated damages on lines 36 through 40. Are there other fines that are this high regards to violations?
I'm glad you asked the question, and I appreciate it. And you are right. The fines that are listed in this bill are significantly larger than we normally see in bills that we do, and that was by design. And the reason is because we are not in this bill telling any school or anybody else that they have to close any offices or reorder the way that they're doing things as far as what type of personnel they have doing what. And so we felt that because of that, and we were given a little bit more specific, we were just limiting it to actions. We wanted to make sure that if some of these offices continued, that they were not doing this, and we wanted to make it have a significant financial disincentive to try to do this in another way or through another office or through another program. And so that was really the intent behind it. And so, yeah, I will acknowledge you that it's high, but it's sort of high by design.
Thank you.
Yeah. Other questions, comments? Representative Garcia-Wilburn, do you want to roll call the amendment? Okay, I did hear a motion a second, so let's go ahead and call the roll on amendment number 11.
Chairman Jeter.
Yes.
Representative Zimmerman.
Yes.
Representative Ireland.
Yes.
Representative Davis.
Yes.
Representative Bascom.
Yes.
Representative Meltzer.
Yes.
Representative Prescott. Representative Lopez. Representative Steuerwald.
Yes.
Representative Garcia-Wilburn.
Explain my vote, Mr. Chairman.
Sure.
I do, again, appreciate the work that you've done regarding revamping and trying to put some parameters around it. I am going to be a yes for this amendment, but I'm just also, I'd like to hear the testimony and see where we are. But this whole basis for trying to quickly fall in line federally, I'm just not sure if we've made the right decision federally yet either. So, yes, for right now.
Representative Burton.
Explain my vote. Yeah,
Sure.
I appreciate you again, like I mentioned, Mr. Chairman, but I think we could just let this bill sit and everything would be just fine. So for that reason, I'm going to vote no.
Representative Dvorak. Representative Bauer.
No.
8-2.
All right, amendment passes 8-2. Representative Burton, you do have an amendment. Would you like to talk about that?
I'm going to hold my amendments, all that I've offered, and let the senator give his remarks, and we'll get it cleared up.
Okay, all right, thank you. So all the amendments, that there are no more. So Senator Byrne, would you like to give us some remarks?
Absolutely. Good morning, everyone. And thank you, Chairman Jeter and the committee for hearing Senate Bill 289. I know the chairman has just made the amendment, and I believe it simplifies the bill, and I think he's made a lot of good changes. So I'm just going to describe why I brought the bill. So one of the most important principles of American government is equal treatment under the law. But in recent years, we've seen more and more people on the left arguing about discrimination is actually a good thing. They just don't use the word discrimination. Instead, we use phrases like diversity, equity, and inclusion, or critical theory. Before that, people used to use the term affirmative action. Under the Biden administration, we saw DEI in basically every federal agency. I don't think it's been rampant at the state level, but my constituents want to make sure that everyone is treated equally, that they don't want Indiana government to engage in discrimination, whatever the intentions may be. I'm glad Governor Braun signed his executive order, and his executive order against the DEI in state government, but I believe this bill, a bill like this, creates more permanent policy than an executive order, and that's why I would hope you support the Senate Bill 289.
Questions for Senator Byrne? Representative Burton.
Yeah, just to start off, right? So on one hand, you say we want to make sure that everyone is treated equally under the law, and then you reference the 14th Amendment. So would you agree that if the 14th Amendment was end all be all, that the 15th Amendment wouldn't necessary?
Yeah, well, I would just tell you the purpose of the bill is based on, everybody should be based on merit and equal opportunity, and that's the purpose.
Okay,
of
perfect.
the bill.
Thank you so much. And then a follow up to that, could you define, so we're speaking on clear terms for everyone listening and watching today, could you define diversity, equity, and inclusion from your perspective so that we're talking on the same playing field and make sure that I'm not asking questions that are irrational or not focused on the issue at hand?
Yeah, well, diversity, equity, inclusion individually is fine, but how it's been presented in our government agencies and our universities, it is in itself discrimination.
Can you give me an example of that?
Well, because of, for example, the Supreme Court has ruled.
No, it's here in Indiana.
Well, that it still is relevant because we, in some cases, are not really following what the Supreme Court ruled. You're using race as an example of deciding on particular, maybe a job or a contract that's awarded. So that could be and has been determined to be unconstitutional.
And what about universities? Have you spoken to any presidents or vice presidents who are supportive of the measure that you brought before us?
Well, I have not, but I will tell you after the executive order from Governor Braun and actually after the Senate Bill 289 passed, many of the universities has pulled back on their DEI policies and from Ivy Tech to, I believe, IU is discussing that now too.
Okay, and then, so I'm getting to the end, Mr. Chairman.
No, go ahead.
So is the Indiana Department of Education supportive, or is the Commission on Higher Education supportive of your what you brought before us?
Yeah, you'd have to ask them.
So has anyone vocally came out to support this bill that you have or that you've authored in the higher education space or K through 12?
No, I mean, I've not gone to them. They of course, I'm sure you may hear testimony opposed to it, but no, I'm going by too with what we've seen in the real world, not only just in the state, but at the federal level, and plus Governor Braun's executive order addressing the issue.
What's happened in the real world in Indiana that has caused some alarm?
Again, it's not rampant, I believe, in Indiana, but I do believe we see this in our universities, maybe even the teachings. Part of the bill that I had that's not in there, it was about the K through 12 teachings in our schools, and that's not currently in the bill, but it's something that we have seen and heard complaints. If you probably go to the Attorney General's website, you'll probably see some examples, complaints there. That he has a website that would give you some of those examples, and that would be one example that I know of. And we also heard testimony from IU med students in the committee hearing on the Senate side that was addressing the problem that they seen in the university.
Okay. From here, Lau, are you supportive of the State Board of Education still issuing the Indiana Student Achievement Report?
The Indiana Student
Achievement Report,
that would be
as is.
as is?
Yeah.
You'll have to explain to me more detailed as is.
You have not. So if you have not seen, heard, read the Indiana Student Achievement Report any of the years that they've issued it, and you're bringing forth this legislation?
So explain to me further your report, and maybe I'll understand what you're asking.
Sure. I'll just give you one statistic here. For every 2 students with free or reduced meals who are proficient on math and ELA, there are 3 who are not. For every 2 minority students who are proficient in math and English language arts, there are 3 who are not. That's just one example of what's in this report.
Okay.
Would you still be supportive of this report being issued?
I'm assuming that would be still allowed under
Okay,
this
perfect.
law.
Thank you so much. And I'll end with this, Mr. Chairman. As we're having this conversation of focusing more on merit than anything else, I hope that in the years and maybe even in this session, we can look at 21st century scholars and we can improve and increase that rate from being at a maximum, capping that at 53,000, moving that number to 250,000 so that more Hoosier families can get a quality education here in the state of Indiana. Thank you so much.
Thank you, Representative Burton. Appreciate your perspective. Representative Garcia-Wilburn.
Thank you, Mr. Chairman. We've talked a lot about the federal level, and Senator Byrne, I had the opportunity to testify before coming to the legislature at the federal level regarding the Allied Health Workforce Diversity Act. Are you aware that the federal definition of diversity includes military families and rural Indiana as well, rural America?
Yeah, in this bill, I believe it's defined on as veterans is one of the protected. So that's what this bill's pertaining to.
But if our impetus is to fall in line with federal standards, we're actually moving away from federal standards by saying some for Indiana will be included in diversity and some will not be included in diversity. Is that correct?
Well,
Because it's not matching up, but that's the goal, right?
I believe the goal is equal opportunity, and that's the goal of the bill.
Okay. Do you believe that rural Indiana sometimes is at a disadvantage?
Well, again, I live in rural Indiana, and we would want equal opportunity in whether it's employment, applying for universities. Doesn't matter. Equal opportunity is what the bill is.
Okay. Even though metric after metric shows that rural Indiana is at a disadvantage in accessing education and healthcare, other resources that are provided in more suburban and metropolitan areas.
I mean, this has been the case in history. There's some that need would conquer those issues
I'm glad you-
on their own
Yes.
without government interference and government directing and government picking winners and losers.
I'm glad you brought up history regarding affirmative action in the civil rights movement. It was documented that at one point in our country we did have segregation, correct?
Absolutely.
Okay.
Yep.
So would we have a tendency to perhaps, when educational structures were created, there might have been disproportionate in way in which instruction was taught to those that were not fully integrated into an educational system? Does that make sense?
Yeah, I mean, if any of that took place, I mean, we have come a long ways, and I'm not going to say we want history talked about, and we do not want to repeat the mistakes of history, but I believe what the term DEI, it is repeating those same mistakes. Equal opportunity is what we want, and to achieve the American dream. That's the way it's always been.
And you're fully in favor of this bill as it currently stands, even though it's radically different than the one you proposed in the Senate?
I will support it. I believe it is going in the right direction, And I appreciate the chairman's amendment. I believe there was a few things I wish it was in there, but of course, you know how this works. Sometimes you give and take, but for the very most part, it's going to achieve the goal of why I presented the bill. Yes.
Thank you. Thank you, Mr. Chairman.
Representative Bauer.
Thank you, Mr. Chairman. Thank you, Senator Byrne. I see in the amended version, so they define personal characteristics as Indiana code. What is that defined by?
Well, you could probably ask the chairman. Discriminatory practices, is that what you're representing to as exclusion of persons of equal opportunity from race, religion, color, sex, disability, national origin, ancestry, or status as a veteran, would be immutable trait or characteristics is what I would characterize that as.
I probably agree with you. Is there any reason why age isn't included in that definition?
I'm not sure that age is why it should be. It might be a conversation with the chairman.
Okay.
But it wasn't in my version of the bill. But
Because there is often some ageism, and it is often a protected class in certain definitions of inclusion or a comprehensive definition of personal characteristics, maybe in other states.
yeah, equal
Okay.
opportunity is what the bill's goal is.
Got it. What about gender identity?
I don't believe that's an immutable characteristics.
Okay.
That changes. If you want to talk about sex, male, female, that's
that's in there.
specific. That's in there. But I don't believe that is the definition of that isn't in the bill and shouldn't be, I believe.
And that's your personal opinion, or based on the
I don't believe
individuals you
that's
serve?
I don't believe that what I consider immutable
Okay.
characteristics. No.
All right. Thank you very much.
Thank you. Any other questions for Senator Byrne? Thank you, Senator Byrne. We'll take some testimony here from you at the end.
Thank you.
We do have a lot of folks signed up to testify, so I'm going to ask Representative Zimmerman to keep a clock. We'll do 2 minutes each. Really, it's important that we let everybody speak since a lot of folks have come here, so I want to try to be respectful of everyone's time. So when you do hear the alarm go off, please do your best to wrap up. Just know that we got a lot of people to get through. Excuse me, we have kind of a hard stop as we have session today. So with that being said, let's start off with Laura D'Agostino.
Good morning, Chairman. I also have copies of summarizing some of my comments today, if you would like me to pass those out.
Sure.
Thank you all, members of the committee today, and for the chair's dedication to this important reform. My name is Laura D'Agostino, and I'm an attorney with Pacific Legal Foundation. We've had the privilege to work with Senator Byrne on the reform in the Senate, and we're grateful to see the progress in the House today. Founded in 1973, PLF is the oldest and most experienced public interest legal foundation of its kind, and we've achieved 18 U.S. Supreme Court wins on behalf of Americans' constitutional rights. Personally, I'm part of PLF's Equality and Opportunity Practice Group, and we work to advance liberty for all and ensuring that everyone is treated equally under the law. To that end, we are devoted to dismantling unconstitutional barriers to opportunity, and we have a long history of challenging the constitutionality of laws that include gender or race-based classifications in public contracting, school admissions, and appointments to public boards, because these classifications tend to perpetuate stereotypes and undermine the ability of qualified citizens to serve their communities. At its core, SB 289 promotes equality by ending discrimination and race and sex-based preferences by state entities. And most recently, the Supreme Court struck down race-based admissions at Harvard and the University of North Carolina under the Equal Protection Clause. And that's because eliminating racial discrimination means eliminating all of it. So in other words, the government cannot treat people differently on the basis of race, sex, or religion, and this bill it's a great step in the right direction We would also recommend eventually managing the issue of public contracting, because there are some classifications to address there, but this bill is a step in the right direction, and other states are following suit. Thank you.
Questions? Representative Burton.
Thanks so much for coming in today. As on this quest for equality, would your organization support school district maps to be redrawn that are based on busing and desegregation?
Representative, we support any measure that would ensure that everyone is treated equally under the law. And so that is a very complex issue that has many components that go into it. So my answer to you would be anything that everyone would be treated equally. That would be a policy we would support, sir.
Yeah, I think you should explore it, only because the families that live right across the street from me are bused 30 minutes away to go to school. And it has everything to do with their location and the old laws that required schools to become more diverse.
Oh, absolutely, Representative. And what I would say is we're heavily involved in school choice as well, and we want to open it up for students to be able to attend schools that they're not limited to their zip code, so they have more choices and parents have more autonomy to give their children the best education possible.
So you mentioned school choice, so I do have to ask this follow-up question. Where did school choice come from?
Well, school choice has been a policy that has been very much advocated within public interest firms to ensure that government does not limit students from achieving the best opportunities and opens it up so that they're not limited to their zip codes.
But why would their opportunities be limited?
Well, sir, as in many different communities, there are regulations that, again, government imposed regulations that say you're limited to attending this school district. Otherwise, if you want a better school, you will be charged. There's also teachers' unions involved in ensuring that these opportunities are not made available to families. So it's a very complex issue.
Thank you so much for sharing that schools are not equal.
Thank you. Any other questions? Thank you for your testimony. Really
Thank
appreciate
you.
it. Kurt Maselli. Tell me if I said it right. I'm trying.
You're doing great.
Okay, go ahead,
Thank you.
sir.
Chairman Jeter, Vice Chairman Zimmerman, Ranking Member Wilburn, and members of the Judiciary Committee, thank you for having me here today to testify on this important piece of legislation which promotes non-discrimination in both state employment and education. My name is Kurt Maselli. I'm Medical Director for Do No Harm Action, and for more than a decade I've also taught at the collegiate level as an adjunct professor. I come before you on behalf of Do No Harm Action, not my university affiliations. Diversity, equity, and inclusion has become the mantra of education throughout the country, building an extensive bureaucracy in schools, especially medical schools. Indiana is no exception. Yet DEI, which promotes differential treatment, sets policies based on race, and influences the composition of a given body based on immutable characteristics, is discriminatory, divisive, and destructive. It views the world through the lens of oppressor and oppressed, putting people into camps based on their demographics. In medicine, the impact goes beyond academia and into the world of clinical practice, where medical students, for example, are chosen by their immutable characteristics to meet predefined outcomes. And when we do that, we compromise the future quality of care those students will provide, the care that patients will ultimately receive. Merit does matter. We know from the Association of American Medical Colleges that scores on the MCAT, the achievement test for medical school, predict medical school performance. And we also know that performance in medical school is correlated to performance as a practicing physician. And we know that certification exam scores on the internal medicine boards, for example, are associated with improved outcomes among hospitalized Medicare beneficiaries. To this end, I would certainly recommend for the committee's consideration standardized test requirements for admission to a graduate or postgraduate health education program, as well as the A through F grade-based assessment for coursework. Grading motivates students to work harder and to gain the excellence that we need them to have as physicians. Additionally, we need to keep our health professional licensing boards free from DEI requirements. Not only is the injection of identity politics into licensing morally wrong, but it will also exacerbate the physician shortage. DEI is unfortunately regressive. It brings us back to a state that not only fosters mediocrity, but also causes division and discrimination. For these reasons, Do No Harm Action strongly supports SB 289 as legislation that will eliminate DEI and thereby restore a focus on merit. Thank you for your time. I'm happy to take any questions.
Questions? Representative Garcia-Wilburn.
Thank you, Mr. Chairman. I do have a few for you. Thank you for coming in today for your testimony. You are stating facts that actually, or data maybe, you're stating some statistics or data that actually, what I'm aware of is refuting what you have presented. So I teach outside the legislature. I'm an associate professor, and MCAT and GRE scores actually have no correlation to how a student does in graduate health profession programs or medical school. So I'd love to see what you have, and if you could provide that after the committee, that would be wonderful.
Yeah, that's interesting. The American Association of Medical Colleges, now granted, they do produce the MCAT, but they have literature that specifically shows the MCAT and its importance in correlating with performance during medical school. So certainly, yeah, we can make sure to provide that link for you.
Yeah, an unbiased. That's certainly biased. I mean, if you're publishing a test, you're going to skew the results in order to show that the test is an indicator for performance. But that's neither here
I
nor
would
there.
say the American Association of Medical Colleges is also the association that has been very supportive of DEI programs. In fact, I would take issue with the American Association of Medical College on many points in the way it has force DEI into many medical schools as part of its requirements and as part of its initiative. I'll also say there was a recent New England Journal of Medicine article that actually spoke to the issue of performance in medical school and a concern that was issued that P equals MD, pass equals medical doctor. That is really a philosophy that the writers in that journal article, the New England Journal of Medicine article, were really sort of saying that does not drive towards excellence, that drives towards mediocrity. And there was actually a call in that article for us to really look as a medical community at a means of having grades that are appropriate, that allow folks to distinguish themselves based on their excellence and to really rise to the occasion. I'm happy to share that article as well.
Yeah,
It was
I'm
recently
also
published.
happy to share an article with you from the University of Pennsylvania that also demonstrates that pass-fail in graduate medical programs and medical schools have no outcome of performance. And in fact, accreditation standards establish for satisfactory, unsatisfactory performance of all clinical rotations. So we're not just talking about medical schools, we're talking about physical therapy, occupational therapy, respiratory therapy, speech-language pathology, audiology. All of these have clinical components which are pass-fail, because we're asking current clinicians to essentially grade students on skills. And so we have to look at the aggregate of students' skills, not a rigid criteria, which would not make for a grade letter. I do have another question for you, though. Again, going back to something in regards to data. Are you aware of studies published that show when providers of the same cultural background are providing care in like communities, those outcomes are actually better for communities? So, for example, if I had a Black physician practicing in a predominantly Black neighborhood, which we know exists, this is not about, thinking about any race space. There is, certain communities that attract Black people, Latino people, et cetera, Irish communities, what have you. But when a provider is of the same background, those patients are more likely to be compliant with medical care than somebody that's not from the same background. You aware of those studies?
So we've actually looked at many of those studies that speak to racial concordance that do no harm. And in fact, there are actually systematic reviews that have been done on just that issue. And 5 of those 6 systematic reviews actually show that there is no association, that racial concordance, Black doctor, Black patient or such, actually really doesn't provide any additional benefit in terms of quality, in terms of outcome. The one study that was out there, the one systematic review, does show an improvement in communication. But again, the body of the evidence there would actually suggest that this is anything perhaps neutral. I mean, I think the thing that people want, that all people want, are excellent physicians, excellent doctors, excellent providers. And I will say on the issue of racial concordance, I mean, much of this is based on studies. There was one study that was done, I believe it was in 2020 in Florida, that actually looked at infant mortality. And it was related to, again, Black doctors and white doctors and Black children and white children and what the outcomes were. And in that study, the initial rendition of that study back in 2020, it did show that there was a benefit, 1 in 1,000, which is significant, right? Every life is absolutely precious. If a black doctor were caring for a black patient as opposed to a white doctor caring for that black baby, and that was from 2020. That study was actually reproduced 4 years later and reproduced in terms of looking at the data. And what it found is that the original study had actually left out one of the most important determinants of whether the baby is going to live or pass away, and that's the fact that the baby is very low birth weight. And when you actually factor in a category of very low birth weight, you find out that white doctors are taking care of many more of those children, and that's actually what's skewing the results. And the overall results are actually neutral in that assessment.
I appreciate that. I know that we're limited on time. I do have one more question
Sure.
for you, but low birth rate is associated to a lot of factors. That is a variability that is a lot of factors, sir. So I'd love to take a look at that article.
Sure. No, absolutely. Happy to share.
Never heard of that. The last question that I have for you is in regards to, you talked about cultural context, right? We've talked about, is it true that maybe those of darker pigmentation heal differently? They scar differently? The symptoms of generalized rashes, lesions, et cetera, wound care, those may look different in a black patient, in a Latino patient, in an Indian patient, correct?
I think we really need to make sure we're clear on what we're talking about, right? I mean, there's some concerns, for instance, with pulse oximetry, that it might not read a black individual's oxygen.
Sir, I'm asking you about wound care healing. Is
I
it
think
true
that-
that darker,
so-
and if it is true, which we know that it is, would this piece of legislation limit the way doctors are able to look at a variety of skin tones and a variety of colors to make sure that when they treat a variety of people, they're providing best care?
I don't see how this bill would weigh into that debate at all. The goal is to have the absolute best care for the patient, and each
And
patient
that
is
includes
an
learning
individual.
about their multicultural backgrounds and race. Thank you.
Okay. Oh, hold on. Representative Garcia Wilburn, I appreciate your passion, and I am a big fan of hard-hitting questions. I don't mind that, but I want you to try to resist the temptation to argue with the witness, okay? Just ask the questions. We'll have an opportunity for a committee debate at the end. Is there anything else that you want to Jose, I want to make sure he's done. Are you anything else you want to say on that line, sir? Or okay.
I think I'm good. I appreciate the
okay.
conversation.
Representative Bauer.
Thank you, Mr. Chairman. Thank you. And did you say you're a resident of Indiana?
No, I'm a resident of Pennsylvania.
Pennsylvania. Okay. Does your organization Do No Harm do anything regarding legacy college enrollment, or you just focus on DEI?
So we're an organization, 16,000 members plus strong. It's formed about 3 years ago.
Sure.
We're a national organization. We're focused on really two primary issues, and that is getting identity politics out of medicine.
Okay.
We see it as destructive and being very damaging to medicine. And our other issue is protecting children, minors, from the consequences of quote-unquote gender-affirming care, so to really help
Okay.
protect those kids.
And so you don't do anything, I noticed that some other states have addressed legacy enrollment where maybe their lineage determines that they would get preference to college enrollment before others. You
That
don't.
has not been an issue that we have
Okay.
tackled. But again, our aim is for the very best doctors to be there, right? And so the very best students to be those future doctors. I mean, that is the overall goal. So whether it's racial, legacy, whatever it is, we want the very best. And I think any one of us would certainly want that when we're on the gurney or when we're there, when we're in the clinical situation.
Sure. Thank you for that answer. I'm sorry. I know there's been a drive to go more merit-based, as you mentioned. So when I look up merit, it means, is it good or is it beneficial? Are you saying, to the point of Representative Garcia Wilburn's, that there is no benefit to seeing a doctor who might be the same race as you?
I mean, I can't speak to the benefit that one individual person may have, but when we look at those systematic reviews, again, 5 of 6 of them actually show that there is no benefit in terms of the outcome, the quality of care, the utilization that is received. Again, there are some studies that show benefit, but there are also studies that don't show benefit, right? I mean, I think it's part of the science, but and that's the reason for doing the systematic review, is so you can boil that together. And when 5 of 6 of those systematic reviews show that there is no benefit, I think the key really is we want excellent doctors going out into the world treating.
I understand that point. Thank you for repeating it. And then I just wanted to mention I pulled up your website and you were talking about the amicus brief of the 2020 study regarding high-risk Black newborns and Black physicians. I will state, since you're not from Indiana, we have the third highest maternal mortality rate in the nation, and our infant mortality rates range from 7 to 14%. So this is a very serious issue, and you don't need to comment on it. But when I looked at the link of the amicus brief, it's been removed from the U.S. Supreme Court website. So I'm afraid a lot of your work that you're referring to has actually been wiped from the federal websites as well.
Well, I will be happy to share that because we have those the papers that are key to the ideology and the study and such.
Representative Burton.
I just have one question. Does your organization acknowledge that the Tuskegee experiment was problematic?
I don't believe the organization has formally looked at that study per se, but I mean the Tuskegee experiment was absolutely awful. And I think we would all sort of admit that there unfortunately have been extraordinary tragedies within the House of Medicine, of which that is one. And we very much recognize that that the movement in our society to that more perfect union is absolutely essential and is what I believe we as Americans over our history have been moving towards. But again, yeah, I mean, such is awful. And there are many other examples, unfortunately, within medicine, within my field of psychiatry, that I can point to of things that we have done that have been wrong to people. And frankly, it's one of the reasons why I want to stand here today to make sure that we continue to move in a better direction for medicine and for society.
Any other questions? Thank you, sir. Appreciate your time.
Thank you.
Hey, by the way, before you leave, are these folks with you? Are any of these folks? No.
No.
Okay, you guys are. Oh man. All right. Well,
They look good.
I've never felt safer than I do right now. So if anybody's going to pass out, this is the time to do it. Thank you very much. Okay. Cindy Bazitsky. Sorry, I'm going to try my best. You tell me if I'm wrong, and I'll get it next time.
Yeah, I'm Dr. Cindy Bazinski, and I'm a practicing physician in Southern Indiana. I've been in practice for 25 years. I'm a urogynecologist, and I'm also a adjunct faculty member for the IU School of Medicine for over a decade. I also am educating for the University of Evansville, as well as University of Southern Indiana, as well as the Deaconess Family Residency Program, so I do have a lot of interaction with students. I speak on behalf of students that are too fearful to stand up today and talk about their experiences in medical school. A lot of students are going to school and unable to speak about things that they disagree with. For example, they're forced to use pronouns. They have to announce their pronouns, and there may be people who don't want to do that. There are also students who are not allowed to speak against minor affirmation care. They're also not allowed to speak against other politically divisive issues, like maybe there are some students who think there are only female and male as genders. These are important topics that are important to discuss scientifically among students. And if students do not feel empowered by administrators or other students to speak up, then we are not going to have the most robust educational system that we can have in Indiana. We are harming the future of healthcare in Indiana by not allowing scientific debate. And what I will say is that there are many students in lectures who have been shut down, spoken down to, silenced, and had adverse consequences as a result of speaking up. So they are fearful and they cannot get up and speak for themselves. I hear from these students because they know that I exist. I live in a place where I feel very empowered as a faculty person. I own my own private practice, so I feel that I can speak up for students who are unable to speak up for themselves. And let me give you a few examples of what has happened. These are actual stories from students in medical school. One of the students was a white male, and they were discussing abortion. And he had spoken up about his opposition to some of the abortion issues. And during that process, another student stood up and said to this white male, "You are a white male, you do not have a uterus, and you do not have the right to speak on this topic." Now, this is a person who is going to be a doctor. This person may be an OBGYN in the future or taking care of women who might be contemplating the idea of abortion. It is important that these students have the right to speak up. That student sat down, did not get to discuss his point of view, and that discussion went on in mostly a pro-choice point of view. Now, I'm pro-choice, but I absolutely feel that everybody has a right to stand up and express their point of view. DEI also extends into other issues. For example, there was an obesity lecture, and I brought this up at the Senate meeting, that when they began to talk about the healthcare issues of obesity, another student stood up and said, "We are not allowed to talk about this, or we shouldn't be talking about this. This is discrimination against obese individuals." And that lecture was not completed. The students did not get to complete that lecture or get the information about the health harms of obesity. And what I'm going to say to you as an educator, I come across students with all kinds of political views. In fact, I had a young female student who was a fourth year wanting to go into OBGYN, and she had many different political views from me. For example, I do not support minor gender affirmation care, but she did, and she did that a lot in her undergraduate work. You know what? She was an excellent physician, and I gave her an excellent recommendation, and I do believe she matched an OBGYN this year. But that is not happening to all the students across the board. They do not feel empowered to stand up. In fact, they're punished. And there are professors and faculty members that are also punished for speaking up against sort of the DEI ideology and some of the factors that go into that. So I speak for the individual students who do not have a voice here today because they're too afraid to stand up and talk. A few students did stand up at the Indiana State Medical Association meeting to discuss their personal experiences, and it was very few. But most of the students that I talked to, I asked if they would come testify, and they will not do it out of fear of retribution. Thank you.
Thank you. Any questions? Representative Burton.
Do you think they don't come to environments like this because they will feel like their opinion is the minority of other persons their age?
I think they're the minority of opinion amongst administrators in education, yes, but I do not feel that they are a minority of opinion among physicians of Indiana. And what I will say is that students in medical school is a very unique situation. You rely on administrators, your educators, your faculty members to write letters of recommendations for you. You rely on these people to advance you into medicine. And if you don't have adherence to the DEI ideology, you severely put at risk your future and your ability to get into competitive rotations and competitive fields of medicine.
So all administrators from everywhere that you've worked ascribe to DEI is what you're saying?
No, certainly not all. I certainly represent one faculty member who does not adhere to that. However, we are far and few between. And if I can tell you that I have been speaking up about this issue for 4 years, and I respect every student who has any point of view. I'm happy to discuss that issue with them. And as an educator, I can have my own point of view, but when it comes down to grading and evaluating students, we have to be unbiased. We have to be impartial. And unfortunately, most educators and administrators in medicine, in education, are very biased towards a liberal point of view or a DEI point of view.
So how will this bill make the lived experiences better in your perspective?
Because there's now punitive measures if you do not allow, if you discriminate people or prohibit them from advancing or use any method to promote them in their jobs or to their future careers by using things like their religious beliefs or their beliefs against certain ideologies, or if they have differences about gender issues such as male and female, or whether there are more than one or two genders. So these are issues that are very inherent to what is happening in DEI and how that is affecting the individual educations of many of our students. And, half of our student body is opposed to a lot of these issues, but they will not speak up about that. And when you find that students that have come forward, and we've seen this in the Indiana State Medical Association, the students that support these DEI initiatives feel very empowered by administrators to stand up and espouse their views. The students who do not support DEI initiatives feel very afraid and fearful, not only from their fellow students, but from administrators within the School of Medicine.
Any other questions? Representative Garcia-Wilburn.
Thank you, Mr. Chairman, and I will I just need some context regarding a liberal bias. What do you mean by that?
Well, and I would say that would be ideology that would be adherent to a lot of the DEI issues. For example, minor gender transitional care across the political spectrum has been more supported by individuals, say, on the left than individuals on the right. And this is really not an ideological issue, but it has been brought into the political realm because of some of these issues surrounding the hierarchy of medicine. And this is a huge topic within our literature, within our associations and the types of ideologies that have overtaken these sort of institutions. And these institutional biases are now creating biases within our student body, and they are supported by administration. And so when you do not adhere to the biases, then those biases can be used against those students in promotion, gaining access to competitive residency programs.
And what evidence do you have to support that? Because I just want to give some context around.
So at IU, they actually had a policy in which for you to achieve advancement at IU, you had to write a policy about how you supported DEI. What was your, and when you were admitted to medical school, there was a specific question on the admissions form about how you supported DEI. And all the students know you have to write a statement describing why you support DEI, even if you did not.
I just want to put some context around that, because I actually used to teach a first-year seminar. It's called Interprofessional Practice and Education. And first-year medical students, first-year graduate students in various allied health professions, School of Dentistry, all come together. And the impetus of the interprofessional practice is to understand the scope and disciplines of everyone's practice, but it's all based upon the philosophy of the client.
Sure.
And client-centeredness.
Sure.
So what, in the institution that you just mentioned, that philosophy is beholden to what the client believes. Practitioners and physicians and healthcare providers aren't projecting their own bias on a patient. They're accepting what the client wants in the client's care. And that might be different from what the practitioner wants, but
Sure.
the client is the driver of the care. So I want to make sure that that's clear, because I think that what you're saying, again, I respect your perspective and opinion, but that you're claiming that that is absolute certain truth, and it's not. So I want to make that clear
So-
for people that are listening in, that
No,
that's not the way medicine is taught.
I take care of a very diverse population.
Sure.
I am supportive of, I take care of many lesbian patients in my practice for many years, have gone to legislation to support lesbian relationships, specifically because that's the population I care for. I have gone to speak on abortion rights. So I don't have a political spectrum. I have patients who come to me who are pro-choice. I have patients who come to me who are conservative in their values, with religiously conservative, or patients. Yes, we always have to be patient-centered. We are currently not. We are emboldening students to use their own personal ideologies and enforcing that not only on their fellow students and some administrators on the other students, but I fear that it's going to lead to imposing those personal views onto patients. And so, for example, let me give you a very specific example. There was a young man who happened to be Catholic, and I don't agree with him, but he does not believe in writing birth control pills. Okay. That individual has that religious belief, and it is my opinion that he has the right to have that belief. He has a right to be in medical school. He has a right to become a physician. However, I can tell you he received a lot of hatred and a lot of backlash, and a lot of students, I heard from several other students, that he shouldn't even be allowed to be a doctor. Now, what I'm saying to you is that people come to medicine with all kinds of beliefs, and yes, we need to be patient-centered, and yes, we're going to disagree with how we each take care of patients. But the important thing is that I come to it with an open mind, that I'm willing to listen to people around me. I'm willing to listen to my patient. I'm willing to listen to the student, and that we can look at clinical objective measures of how good of a doctor that you are. What is your educational skill? What is your knowledge base? What is your ability to take care of patients separately from what your actual beliefs are in your mind? And right now in medical school, that is not happening. What is happening is that only certain ideological points of view are supported by administration. And if you stand up and you speak against that, there are consequences to that not only are from day to day from other students or faculty members, but for advancement into positions that are competitive, or advancement in their grades, or how it shows up in their evaluations when they complete a clinical rotation.
Any other questions? Thank you very much for your testimony. Appreciate that. Mark Russell.
I'm sorry.
Mr. Russell?
Yeah. And I'm sorry, I'm hearing impaired. And others would greatly appreciate if the members of the committee would speak into their mics. It's very hard to hear, especially in this room that is too small for its purpose. My name is Mark Russell. I am Director of Advocacy for the Indianapolis Urban League. And I'm here today representing our constituents to vigorously oppose this bill. I would remind the committee, and it was just not too long ago, 57 years ago, on this day, the United States of America was on fire because of the assassination of Martin Luther King Jr. 126 cities were had in a position of riot. And we're still trying to deal with this nagging, and we're trying to grapple with this issue of race. And everyone has their own story, but this bill will do nothing to promote equality. In fact, it will fracture society as it was intended to by its authors. Equal opportunity is written in law. It is not theory, it is not opinion, it is law. Laws that were written on the basis of historical facts, which we are sadly lacking in this legislation. We need to be aware of its impact in real life. This is not theoretical. And I would venture to say, if this committee were looking at the rights of white people, their opinions would be probably quite different. So yes, it is a racial issue. And we need to acknowledge that at the front. Now, as far as this legislation goes, I'm reminded of the Great Compromise that said that some people were 3/5 of a person for purposes of representation, okay, 3/5 of a person. They called it the Great Compromise. What it was a great mistake. And the authors of this bill are in the same position. They are trying to superimpose personal beliefs for their, what should be public interest. We've come a little ways since Dr. King died, but we don't have legislation like this concerning ourselves about perceived unequal opportunity for no other persons. If you're a dark skin, you're a target, and DEI to some means you did not earn it. There is no merit automatically bestowed by your race. There shouldn't be. And that includes the white race. We need to be aware of what this body is promoting through this legislation. We oppose it. And in closing, we note that in Indiana law, a misdemeanor is fined by $5,000, a felony by $10,000, not $50,000. That in itself sends a real message about the true intentions of this legislation. Any questions? I'll be glad.
Any questions for Mr. Russell? Representative Garcia-Wilburn, before you go on, Mr. Russell, one thing we don't really allow in the committee is we don't allow the imputing of motives of any individual lawmakers. So I would ask that you just please speak to the bill and the policy of the bill and don't talk about what you think people intended, because that's just not proper in the committee, okay? Representative Garcia-Wilburn, go ahead.
Thank you, Mr. Chairman. Last session, we passed Senate Bill 202 regarding intellectual diversity. how do you feel about current law that's on the books right now? I just want to read you this sentence. Make recommendations to promote recruitment and retention of minority and underrepresented students. That's work that we just did last year. Do you agree with that statement?
In part, I think what, as many politicians do, they're trying to say things without saying them. We were crafting an amendment for legislation, and we're told specifically you cannot use the word black. You could only use minority or underrepresented. Now, without impugning motives of anyone, that is a curious position that we cannot be real. I support that language because it attempts to be inclusive, but behind it lies a sad reality of not facing fact. The fact is, we're a diverse society.
Other questions? Seeing none, thank you.
Thank you,
sir.
And I do apologize for going over the 2 minutes. Unlike some who have did that with impunity, I do recognize that. Thank you.
Thank you, Mr. Russell. And the committee's questions obviously don't count towards your time because they have a right to ask what they want, but I appreciate that. Sarah Comfort?
Hi, everybody. Sorry about that. I was just out in the hallway. There's a big crowd out there. So thank you, Chairman Jeter and members of the committee. My name is Sarah Comfer, and I'm the Public Policy and Advocacy Director for Marion County Commission on Youth. You may also know us as McCoy. We're a youth service intermediary, and we work to support the adults and professionals who serve youth in central Indiana, whether that's in our schools or throughout the community. I want to thank you for adopting Amendment 11. This makes Senate Bill 289 a bill that we can support. However, we do have concerns that were mentioned earlier today with Chapter 7's cause of action, where the fine of $50,000 to $100,000 is placed on anyone who violates the policy. The maximum fine, as was just mentioned, for a Class A misdemeanor in Indiana is $5,000, and for a felony is $10,000. And so we think that the $50,000 to $100,000 seems extreme for what might be an honest mistake by a classroom teacher. So we would like to see Chapter 7 removed or at least amended to reflect a more attainable fine so that it gets people's attention of the discrepancy, but does not destroy a school teacher's life or burden school corporations with additional costs. Again, I want to thank you for Amendment 11 to this bill, and I think that it really improves on the legislation. I also want to reiterate the importance of ensuring that diversity, equity, and inclusion exists when it comes to hiring practices of educators. We need to see teachers reflective of the students that they serve. This means more men in the teaching profession in general, more women teaching STEM curriculum, and people representing diverse racial and cultural backgrounds teaching the diverse student population in Indiana. It's my hope that we can continue to come up with strategies to recruit and retain educators with backgrounds and lived experiences reflective of the students that they teach in our schools. Thank you so much, and I'm happy to take any questions.
Questions? Representative Burton.
You mentioned schools specifically and teachers reflecting the demographic in which they're in which they're educating. Can you give examples or instances of where you've come across and where seen that's beneficial to the classroom?
We work with schools from all over, predominantly central Indiana, and we've found that oftentimes when there are students of minority backgrounds who have teachers or educators in their life of similar backgrounds, then that increases the trust between the student and the teacher. It allows for kind of open communication, conversation. There's just kind of a shared lived experience that really kind of adds, I think, to a student's life. So.
Any other questions? Thank you for your testimony.
Thank you.
I really appreciate it. Mustafa Muner.
Good morning, committee, and thank you, Chairman Jeter. My name is Mustafa Munir. I am a first-year medical student at the Indiana School of Medicine, but I am speaking on behalf of myself and as a lifelong Hoosier. So I wanted to thank you for adopting Amendment 11. It is now a better form of the bill, in my opinion, and I encourage for that amendment to be kept as this bill moves on to the conference committee and it convenes again with the Senate side of things. However, I would like to again just address this very high fine that's been mentioned a few times. I fear that it might create an unintended chilling effect on educators just because they might not, rightfully so, want to pay $50,000, $100,000 if they make a mistake, and it could cause the impact of this bill to go beyond the intent and what is written. I also wanted to speak real quickly on the merits of diversity in medical education and practice. For a very long time, growing up in Indiana as, coming from a Pakistani immigrant family, it's a very different lived experience than many of my colleagues in elementary school, middle school, high school. And, you can learn, and my colleagues can tell you, you can learn all about allergies, neuroscience, but you can't learn about someone else's lived experience. And by having a diverse group of medical students who will become future medical practitioners, you'll have the ability to have that concordance between doctor and patient in their cultural and lived experience. Something that really helped me when I had a South Asian therapist who understood the background of that cultural differences and was able to help me much more than I believe a white therapist would have been able to. Thank you, and I can take any questions.
Questions? Representative Burton.
Yeah, thank you so much for being here. Does legislation like this make you want to continue to make you want to stay in Indiana post-graduation?
As someone, like my family's been here for almost 20 years, and I did have pretty big intent of staying in Indiana, but if bills like this continue to pass and hinder on medical education, it might push me to want to go practice in another state.
And would you agree with the professor who spoke earlier about the complications and the ability not for students not to feel welcomed in the classroom in the course of discussion and education?
Not at all. I have never witnessed anything of that matter. And in Indianapolis, at least, we have the largest group between any of the IUSM campuses, 150 of us in just the first-year class, and I've never witnessed or heard about anything in my class.
Any other questions? Thank you for coming. Thank you for your testimony. And after you all are done testifying, you don't have to stay if you want to leave. I don't want to make you think you got to stand the whole time. Joseph Keller.
Hello, so my name is Joseph Keller, and I just kind of want to emphasize, similarly, I'm a medical student from Indiana University School of Medicine, but my beliefs are my own, and I'm not speaking on behalf of the school. Also like to clarify that I'm speaking on behalf of a lifelong Hoosier, not somebody from out of state coming to try to tell us what to do with our personal governance. And I just wanted to state that I really appreciate Amendment 11. I think it really kind of captures like common ground. It's a good bipartisan effort, specifically to address the concept that discrimination is discrimination. I certainly hope that everybody here and everybody in my classes would agree with the wording of the bill that says, with Amendment 11 specifically saying, a person with a certain personal characteristic is not inherently superior or inferior to a person with a different personal background. I just wanted to share specifically that from our perspectives as medical students, we're kind of concerned about these essential teaching and kind of tying back to that intellectual diversity bill, for example, having a bill like this that just kind of bulldozes through there that's written without much purpose, in my own personal opinion, kind of taking over and getting rid of those efforts to focus on creating a diverse and inclusive educational environment. To me personally, I see these DEI, so to speak, initiatives more on focusing on creating collaborative physicians, empathetic physicians, and kind of understanding about people from different backgrounds, especially, we're that melting pot of the world. And I think it's really important to recognize that everybody's not coming in with the exact same set of circumstances, et cetera. And kind of tying into that early example with the skin tones, for example. That's something that I think is really important. I'm kind of concerned that is going to get caught up because, for example, with different amounts of melanin pigments and all that, it really can be difficult if you don't have examples presented to you to be able to tell oh, this is this on this skin tone versus that. And I kind of am concerned that that's going to be impacting people in the future if we're afraid, if people are just afraid of the giant bulldozer bill fining them hundreds of thousands of dollars, that they're just going to shy away from teaching it in favor of playing it safe, so to speak. And kind of want to emphasize kind of clean up my thoughts. One other thing I was just going to state is I feel like a lot of the people that are speaking about this are kind of removed from the process of medical school admissions. Feel free to ask me, like, I'm 1 year out from it, so I know whether or not essays, et cetera. And thank you for your time overall. I just appreciate the opportunity to be able to speak before the committee.
Representative Burton.
Thanks so much for coming here again. And I just want to ask the question, how do you feel being asked about or applying an application process regarding DEI? Do you feel like this puts your career at jeopardy and feeling like you're missing out of anything?
So it's kind of funny that it gets mentioned because I don't know how familiar the committee is with like the AMCAS like admissions. So basically there's like, one overarching like application, send that off to medical schools. If they like you, then they send you back a secondary, so to speak, where you have usually a couple essays. But it's really funny because Indiana University School of Medicine doesn't have a secondary. So it's not, we've never actually gotten any, at least in my time of my M1, and I bet my colleagues going back will agree, we don't get those supplemental essays. So it's really funny that that's getting brought up as a concern to begin with when I was never asked any type of question about DEI. Like, it's pretty trimmed down versus other schools. Like, I didn't even get asked about, like, how did COVID affect you? IU keeps it very bare bones to the facts, mostly a statistics-based process.
Representative Bauer.
Thank you, Mr. Chairman. Thank you, Mr. Keller. And to the same point Representative Burton brought up, we did pass legislation last year that actually, it was Senate Bill 202, prevents pledging allegiance or expressing personal support for political actions or political ideology. And we're actually we've charged the Committee of Higher Education to collect data regarding freedom of speech and academic freedom and intellectual diversity. So I believe that some of those concerns of the previous testimony were addressed with legislation like that, and you can attest to not having to meet those types of acclamations to diversity, equity, and inclusion in the application.
I'd certainly agree with that. Specifically, I have never once been, felt like I was being punished for having my own viewpoint. I feel like in general, medical students aren't a monolith. It's not like we all have our own opinions. Kind of like, for example, the physician earlier saying abortion might not necessarily match up. I think it's one of those things where academic freedom is very important because it's one of those things where I think if you have an opinion that kind of goes against the norm, you certainly should be allowed to defend it, but at the same time, people should be allowed to question it. I think IU currently is striking a really good balance of, people are able to defend their viewpoints when at the same time not being afraid of being punished by kind of I don't want to say bulldozer legislation is how I'd put it. It's just kind of the idea of I don't really get what issue this bill's fixing right now. I'm hearing a lot of these concerns that don't really seem to represent what my own personal experiences as a white man at IU are. And this just kind of seems like a legislating to legislate. I don't really know what real issue this is addressing.
Representative Davis.
Thank you, Joseph. Joseph is a constituent of mine, and I appreciate you being actively engaged. And he's followed this bill from the beginning, so I appreciate you coming and testifying and giving us your input. Thank you.
Thank you very much, Representative Davis.
Any other questions? Thank you very much for your testimony. Appreciate
Thank you for your time.